In Malawi, you'd find that a lot of research is done, but very little of it actually gets into policy making or decision making. So you find that the impact is not as much as we'd like to have. So the LEEPS program helps us particularly to work more closely with the government to understand what are the policy questions that they have that need evidence. So really understanding what is the need that government and other policy makers have, and then enabling us to actually be able to meet that need, whether it's through evidence synthesis, so pulling together existing evidence that is there and making it more accessible and available to them in a format that meets their need. Because I think one of the challenges that has been there is that the research is usually maybe in publications, scientific publications, and it's difficult for implementers or practitioners to use it as it is. So it gives us an opportunity to strengthen our capacity as a policy unit to be able to serve the needs of the policy makers by providing the evidence that they need in a format that is user-friendly, so to speak, for their use in decision-making. For us, we are planning to use Delphi workshops to actually help in defining what are the priority questions that they need evidence for. So that's one strategy. So it's more of the needs identification. And then we will be also then conducting like rapid evidence synthesis to identify the research that is there, and also then to identify if there are any gaps in the evidence that is there. So conducting or developing evidence maps, evidence gap maps. So that will make it more clear. Like you find that maybe there's a lot of evidence in one area, but there is another area where nobody's actually looking at, generating evidence in that area. So that's one strategy that we're going to use. And then of course there'll be a lot of capacity building within our team, but also hopefully with the institutions that we're working with, the government institutions, so that they can actually be able to use the evidence that is being generated. So those are some of the strategies. And of course a key area is also contributing to developing a digital platform that people can actually use to access the evidence that is there. There will be a lot of improvements in the level of use. Currently it's quite sporadic. So you may find that maybe some departments are using evidence more as compared to the other departments. But what we would want to do is make sure that it's happening across all the departments so that everyone has the capacity to actually use evidence. So we're hoping that by the end of the project, or at least in 3 years' time, we can see more institutionalized use of evidence across the different departments, and that capacity is really strengthened in-house of the ministry, that even without a project, they still continue to search for evidence and actually use it in their decision making. So that's what we hope to see.